Hi everyone. In this video lecture, we'll have an overview of the cranial nerves. So as we mentioned before in the previous video lecture, cranial nerves, they are considered part of the peripheral nervous system. So despite their location is they are located in the brain, uh, so it's a wrong conception if we think that they are part of the central nervous system. Okay, in fact, they are peripheral nervous system. If we have a look in this at this view, this is an inferior view of the brain. Okay, so in this view we can see better the cranial nerves. So there are 12 pairs of cranial nerves, and their main function is to relay information between the brain and parts of the head and neck. So the 12 pairs of cranial nerves, they are numbered according to their location. So uh, their location from the top to the bottom, and also from anterior to posterior. Okay, if you look in the sagittal view, um, these 12 pairs, they are all located, they all emerge from the brain stem, except pairs 1 and 2, because pairs 1 and 2, they emerge from the forebrain. But all the rest, from 3 to 12, their exact location is at the brain stem, okay? This is another view in the sagittal view, so that we can see we can see 10 pairs here from 3 to 12. Okay, so as I mentioned before, their location is their numbering is according to their location from the top to the bottom. Okay, this is an exception, the 12. Okay, but it's quite intuitive to remember this location according to their numbers. And here we have in this table, we have the 12 pairs of cranial nerves, their names, function, and type. Okay, so the 12 pairs, they can be classified according to their function. Okay, so they can be only sensory nerves, they can be only motor nerves, or they can be both. They can be mixed. Okay, so when we see here both is the same as mixed type, meaning that they can be both sensory and motor. Okay, so is it important to learn all these nerves, function, and type? Yes, this is important. So let's have a look in what they are. Number one is olfactory nerve, and they are related with the smell. Okay, so it's better actually to show you the next picture. You have this table here with the functions, etc. And then in this drawing, we can see this can be easy to remember. Okay, their locations and function. So first of all, number one, I draw here this face. Okay, you should remember this face, this picture, and number one corresponds to the nose. Okay, so number one, nose, this is related with smell. Okay, so this is the olfactory nerve. This is only sensory nerve, so the function is to sense the olfaction, okay, or the smell. Then we can draw here in the eyes. We can draw 2, 4, and 6. Okay, so 2 in the eyes is the optic nerve. Optic nerve is a sensory nerve. Okay, and is related with sensing the eyesight, vision. Then we have number 3 here, located in the eyebrows. Okay, so number 3 is the oculomotor nerve. The oculomotor nerve is a motor nerve, as the name implies, and is related with all movements in the eyes, and also to elevate the eyelid. So when I do this movement, this is the partly of the oculomotor as well. Okay. Then we have 4 and 6 here inside the eye. Okay. So 4 is the trochlear nerve. The trochlear nerve is a motor nerve, okay, which is implied with the superior oblique muscle, which is a muscle that controls eye movement, mainly eye movement like to medially and downward the direction. Okay. Then we have number 6, which is abducent. The abducens nerve controls eye movement as well, and it's motor. So it moves the eyes laterally, as the name says. Abducens is abduction of the eyes. Okay. Then we have number 5. Number 5 is the trigeminal nerve. As we see here, is a big nerve. Okay, so the trigeminal has this name because it means triplets. So it has this branch here, which is called ophthalmic branch. This part here is called maxillary nerve. So ophthalmic nerve, maxillary nerve, and mandibular nerve. So ophthalmic, maxillary, and mandibular, it makes up the trigeminal nerve. Okay, so this part, ophthalmic and maxillary, it's sensory, they are sensory branches. So this one here provides sensation to this area of the face, okay, in the forehead. The maxillary nerve provides sensation to this area here in the maxilla, okay, so all sensations in this area. And the mandibular nerve, which is the lowest of them, it has the function. It has a mixed function. It can be both sensory function of sensation of this area of the mandibula, and also the motor function of the chewing muscles in the mandibula. Okay, located in the jaw. So this is the trigeminal. Then we have 7 here. It's all the face. So 7 is the facial nerve. The facial nerve is a mixed nerve, okay? It can be motor because it can control all muscles of the face, like facial expression. If we're angry, if we put an angry face, or if we put a happy face, when we eat our favorite food, for example, so it controls facial movements. In the motor side and in the sensory side, it's also responsible for providing sensation to the anterior part of the tongue. Okay, so more specifically, 2/3 of the anterior part of the tongue. And also promotes secretion of saliva, okay, because it innervates the salivary glands, as you see here, part of the facial nerve. Then we have 8. 8 here is the vestibulocochlear nerve. Okay, the vestibular cochlear nerve is located in the ears, as you see here. This is a sensory nerve, which is more related to providing sensation to the vestibular system related to balance, okay, and to the cochlear system related with hearing, okay. So it's vestibular cochlear nerve. The function is to provide sensory information of balance and hearing. Then we have number 9, 10, and 12. So we draw a tongue here. For number 9 here, number 9 is the glossopharyngeal nerve. Okay, glossopharyngeal nerve is mixed nerve. Okay, and it's more related with providing sensation to the posterior part of the tongue, 1/3 posteriorly to the tongue. Okay, and the motor function is to control the pharyngeal musculature. Okay, so glossopharyngeal, as the name says, tongue and pharynx. Okay, and it's mixed. Then we have number 10, also located in the tongue, but 10 is actually, this is the vague nerve, okay, the vagus, sorry, the vagus nerve. So number 10 is the vagus nerve. Vagus because it has a function that is like wandering function. It has many different functions, both sensory and motor, as we see here. The vagus can control the heart, lungs, the gastrointestinal tract. Okay, so the vagus has like many innervates many different viscera in the body. And then finally in the tongue, we have 12, okay? The 12th pair of nerve is the hypoglossal. The hypoglossal is only motor, okay? The name means that it's located under the tongue, a hypoglossal. So it controls the movements of the tongue, the hypoglossal. And finally, I put here number 11 in the shoulders, okay? Number 11 is the accessory nerve. The accessory nerve is only motor nerve, okay? And it's related with the movement of shoulder elevation when we do this movement, and also controls some of the head movements like tilting the head. Is also part of the functions of the accessory nerve, number 11. Okay, so this is an easy way, I hope, to memorize these nerves. Okay, and if we go back here, here we have these functions. Okay, and we have also mnemonics to remember the order of these nerves, okay, according to their names. So we could say O, to touch and feel very green vegetables. Ah, so this is like for if you are vegetarian or vegan, this could be helpful for you to learn and at least learn the order, okay? And on this side here, the type, we can also memorize with another mnemonics, okay? According to their type, if the sensory, motor, or both. We could say, some say money, we could say, some say marry money, but my brother says big boobs matter more, or big brains matter more. Okay, according to your taste, you can say, you can memorize this B as you wish. Okay, so there we go. We have like a function of these nerves as well. Thank you for watching. See you soon.